Flu cases are on the rise in Georgia and all across America. Doctors credit more gatherings and looser COVID restrictions for increased spread. And now doctors are worried about dealing with both COVID and the flu at the same time. Joe Ripley is here, and Joe, you spoke with a parent who did not want to risk her kids going without both the flu and the COVID vaccine.
That's right, Jeff. A near 60% uptick in flu visits across the state of Georgia, plus that uncertainty over this year's flu strain had Parole Benders concerned. So far, her 3 sons have not gotten the flu, but with a COVID scare earlier this year, she's not taking any chances when it comes to protecting against both. Parole Benders has 3 sons. Each one got their flu and COVID vaccines.
I didn't necessarily want to take the risk to find out how COVID would, how they would respond to COVID. We already had our youngest one actually have COVID the first week of school.
Her middle son has asthma. While masking and social distancing made for a milder flu season in 2020, Benders realizes getting the flu shot now could protect her kids during a more active flu season this year.
I think the best thing is just to be prepared. It is a little scary that COVID and flu are both circulating at the same time.
Dr. Hugo Skornick sees a lot of similarities between the COVID-19 pandemic and the flu, from symptoms like fever and coughing to prevention measures.
Things like good hand washing, even wearing a mask, and certainly getting the vaccines all are applicable both to COVID and to the flu.
The flu most affects kids 4 and under, according to data from the Georgia Department of Public Health. Data also shows kids in that age range account for close to 40% of the state's 17,000 flu cases.
Kids, as we know, they're not always the best with their hand hygiene, and they run around, and they, sometimes they're in daycares, and they can, slobber a little bit. So all those things cause the spread of flu.
And Bender says her kids have seemed relatively healthy, hopeful and confident the vaccine for both the flu and COVID keep it that way.
Why not take that extra step if it's not really going to affect you negatively and protect yourself as well as the people around you?
And doctors encourage parents tonight to talk with their pediatricians. Anyone over 6 months is eligible to get that flu vaccine. And if your child isn't necessarily a fan of needles, anyone over the age of 2 can take the flu vaccine in the form of a nasal spray.